Are you going to talk like that on your head the whole time?
Maybe.
You're not going to be able to move. You're not going to be able to do your typical mannerisms.
Maybe I won't talk as much.
That's a bonus. That's a bonus for all the viewers.
Yeah, that's right.
Are we on?
We're on. We're
on.
I already hit record. Yeah.
Dr. Andrews.
Dr. Pursley. Greg Pursley here in Cape. Yeah, Between Two Spines again.
Episode 4. We're already a month in.
How crazy is that?
It is crazy.
Right in the middle of the coronavirus.
Yeah, we picked a bad time to start this great show.
I'm pretty impressed by myself that I can
it.
hold that on my head like that. I feel like I've got a pretty flat head.
I think you might have too much time on your hands.
Yeah, right. What we're going to talk about today is a little bit of some of the conditions that we treated today. Just today.
There's quite a few.
We have a lot of people calling in still asking if we're open. I'm like, yeah, we're open. We're here.
We are open. There's a couple of chiropractic offices that are closed. So
That's true.
But we are not. We're open. We're running, and we're busy because we're wearing a bunch of hats.
We are. Oh my gosh. Lots of hats. What we mean by that is, got to have the chiropractic hat, and then the business hat, and then the marketing hat, and the front desk hat, and administrative hat. We just keep switching the hats on and off all day.
Scheduling hat and phone answering hat.
Yeah, we're doing it all. Our staff is safely at home in quarantine, making sure that they aren't exposed to anything or have any risk of exposure. We're coming here and taking all the proper precautions to make sure that our patients are at low risk or at no risk of being exposed. In fact, we're starting to see people from the hospital or from local medical doctors' offices because we are at lower risk. We don't treat people that have infectious issues, and therefore they're coming here instead.
Yep,
pretty cool.
Which is good.
What's some of the stuff you treated today?
Today?
Just today.
I saw some neat stuff today. I saw pregnant women. I love treating pregnant women.
Yeah.
She called in asking if we could help, or if we treated pregnant women, but also asked if we could help pregnancy-related back pain. And that was like a big yes to all that stuff.
Yeah. Most people don't know what we treat, and I thought that was interesting. A good topic for today, because then people could actually tell us what issues they have or ask us questions about what we treat. I treated somebody with foot pain with my laser. With the laser that we have, she had outside of her foot pain, and she's had it for a little while. And
I like that laser.
Yeah, that laser's pretty sweet. Class 4 laser, pretty awesome.
Yeah, it's not like the beam laser you guys are probably thinking about. It's it's an invisible therapeutic laser. It's awesome. Yeah. You want to say anything else about it? Yeah.
When you
say laser, I think like, do you remember that movie with Val Kilmer?
I don't remember that movie. I don't watch movies.
That's right. You don't watch movies.
We go through
Well, there's a movie with Val Kilmer called Real Genius. It's a great movie.
Never heard of it.
But they shoot this laser down from space, and he sets up this huge bowl of popcorn, like as big as this room, and it overflows this guy's house and pops all the popcorn. But
okay, well, it doesn't do that. It doesn't do that.
It doesn't like laser, shoot out laser. But when you say laser, immediately that's what people are like, laser?
Yeah.
That's weird, laser.
Well, yeah, so it's you can't see it. Laser. Oh, yeah, okay, you can't see it. It is a light source that goes into the tissue and increases something called ATP, which is adenosine triphosphate. What that really is your body's healing energy source. So it is, in essence, it stimulates that and allows your body to heal quicker, to get you over the injury quicker, and it works really well for plantar fasciitis and carpal tunnel and knee pain and shoulder pain and hip pain. I've used it all over. But today, it was somebody's foot pain. She had pain in her joint of her foot, and then we adjusted her low back. So it was really cool. Yeah. But that was something else. What else did you treat today?
I had someone with a disc bulge in their neck. A lot of people don't think you can get disc
bulges. You can treat disc bulges?
Absolutely.
Oh my gosh, I had no idea.
That was just one of our conditions of the week a couple weeks ago.
That's true.
If they've been paying attention to the Facebook page, they've definitely watched some good movies or good videos on disc bulges.
If you've been paying attention to the Facebook page, hit like, share, comment, those type of things, because condition of the week is every week we do a new condition, trying to educate people on just every condition that we can treat. We had more than 52 that we came up with, by the way. More than 52, but we limited it to 26 so we could, the main ones that we treat. And one of them, yeah, you're right.
Disc bulges, yeah.
This week, what is it this week?
Whiplash.
Whiplash is this week.
Yeah.
That's true.
So she had numbness and tingling going down her arm.
Yeah.
So actually, which is one of our other conditions coming up, because that can be caused by a whole bunch of different things, but definitely disc bulges. So
See, I treated somebody with low back pain today. I mean, low back disc bulges as well. She also has some other issues like spinal stenosis. But anyway, so you treated disc bulges today. I've treated spinal stenosis.
I had a migraine. I had 2 or 3 migraines today.
Treated 2 or 3 migraines. Wow.
And then we had the typical people calling in on Monday that hurt themselves. Over the weekend, like you almost did, rewiring your house.
Yeah. Well, yeah, I had to run some wire in my house, and a little known fact about me: my dad, growing up, he was an electrician, and I got to help him wire things a lot. So I appreciate it now. As a kid,
my dad, love you, Dad. Not so much learning.
Not so much learning.
Not so much teaching how to do things. Sports for sure, but once the senior year was over, as far as any of the trades or anything like that, I got nothing.
Got nothing.
I know a little bit about a lot, just enough to make the job way harder and longer than it should be.
Well, that's enough to just when you're getting into it, you're thinking, "Oh, I can do this. I can figure it out."
It's usually YouTube, Google, calling my wife's dad. Yeah, so
that's great.
But again, Dad, love you, but he passed on athletics, not. Yeah.
My dad was one of his claim to fame was get a job that you can learn something, and so he made me get a job. He didn't make me, but he highly encouraged me to get jobs like I worked at a tire shop for a little while, so I can mess with tires and I can fix cars up.
I did the same thing. Yeah.
And then I worked as
he made me do some jobs.
Yep. And then I worked as a construction worker for a little bit. Did some roofs, some basements, poured some concrete with it.
That's cool.
Built some decks, built some.
That's why every time something
houses
happens here, I'm like, "Hey man, this is going on." You're like, "I'll take care of it." I'm like, "What? How does he know how to do that?" And there's something else. I'm like, "Hey, what about this? I'll do it." What? You don't know how to do that? I guess you do know how to do a lot of this stuff. I know, right? It's impressive. See, I don't know how to do a lot of that.
I've got skills, man. Skills pay the bills. The reason why I'm holding these, by the way, is I think we're gonna give them away. You asked me why, and I really didn't know why.
Yeah, you're just.
But I think let's give them away. We got a BioFreeze tube if you want that, comment. And then we got a Sombra tube, and if you want that, you can comment or either one. Actually, which one do you like better, BioFreeze or Sombra? You can comment which one. Yeah. Wow, we're starting to think alike.
I guess it depends on what's wrong on which one you like best, right?
Which true. Yeah. Well,
tell them how to use it. A lot of people use them wrong.
That's true too. They'll come in and say, "Oh, should I rub BioFreeze on this?" BioFreeze is more of a pain reliever gel. Sombra is more of a muscle relaxant or muscle warming gel. So if your muscles are tight, you want to use Sombra. If you have joint pain, you want to use BioFreeze.
Boom.
Simple.
Simple as that.
Easy enough. So depending on what you have, that's what you should comment down there to win. So what else did you treat today?
What else did I treat today?
Yeah.
A couple basic things. Had quite a few maintenance patients in.
Oh, I had a rib. I had a rib today.
Ooh, I like the ribs.
Yeah, I had a rib. Yeah. They came in with major pain in the back on the right side, and they said it was wrapping around. They're like, "I think it's my gallbladder." And I was like, "Nope, it's your rib."
And what's the next question they say after that?
What? Your rib?
I can have a rib out?
What are you talking about? Well, yeah, that's another common thing. Yeah. Like they think a rib out of place, but it's not out of place. It's just immobile and inflamed. And so we have to make it mobile and reduce the inflammation.
Get it moving, yeah.
That's right.
And it can give them pain in the back, but also, wrap around the front.
I had a guy one time with a rib issue. He had been to the hospital. He'd been to his medical doctor. He had $18,000 of testing done. He had an MRI, EKG for a rib. Well, they didn't know it was a rib.
But you did.
But when they came in, he came in and I palpated, which is feeling the spine, and found that spot and said, "Oh, you mean this?" And he was like, "Yeah, that." I said, "Oh, it's a rib." We adjusted it. He stood up and went, "My pain's 80% gone right now." And he goes, "How much is this going to cost?" I said, today's going to be around $100. He's like, "Are you kidding me? $100? Should have come here first." I was like, "I know, right?"
Yeah, absolutely. Once people start, that's one of the things we teach is try chiropractic first, the most conservative first, and then we can go from there. He and I are trained to send out for any advanced imaging or additional tests if we need to.
Yeah.
See, that's the problem nowadays. Actually, is and it's not just
back in my day. Are we gonna go there?
Which was a Wednesday. So
that's the problem.
Yeah, it's a problem. Is people do it backwards, and we're not just harping on the medical community. There's every healthcare provider.
It's a society
Seems to do it backwards. Is we're taught as physicians when we're talking to our patients and are examining our patients, and even watching them walk down the hallways, we have a working diagnosis. And we have a couple of things we think is already wrong with you just talking to you.
I'm always watching.
And and then we examine you, and then we do X-rays or anything additional to rule in what we're already thinking.
Okay.
But what is wrong with a lot of things is they rule everything out.
Right.
They're in such a hurry. They don't have a working diagnosis, and it's not their fault, and they're busy. They're backed up. They got hours and hours of people in the waiting room, and they're like, let's just do all these tests to try to rule everything out and try and figure this, which is what happened to your patient instead of doing a proper exam.
Well, in the medical world, it's 80% testing,
right.
20% treatment. In our world, it's the opposite. It's 80% treating, 20% testing. A lot of times we can figure stuff out just by doing a physical exam, and once we come up with an idea, then we can, we need an X-ray, one test, or an MRI, one test.
You know what? Speaking of that, in college or in chiropractic school, one of our professors gave us the idea that we should go to the mall and just people watch. So me and my roommate would go sit on a bench, and I'm sure we looked super creepy because we were just kind of like just back and forth like people watching. But we were trying to figure out if we saw someone with a limp or walking sideways or a worn